What's up, everybody? Dr. Coach Kelly here, physical therapist, high school soccer and basketball coach, and today we are talking plantar fasciitis. This is a really common diagnosis that I see, especially in active people. What it is it's a cycle of inflammation that can be caused by a couple of different things, and this is just a few of the most common causes that I see. People who have flat feet or low arches and tend to pronate are more prone to get plantar fasciitis. Really tight calves, so people who don't stretch a lot, or people who all of a sudden just started to move after they hadn't moved in a little while, and tend to get really tight calves, can be at higher risk of developing plantar fasciitis. And also a change in footwear or a change in activity level, right? So you either had never worn sneakers before, or all of a sudden you started wearing a ton of flip-flops. That can be all of a sudden, okay, now I'm starting to get this pain at the bottom of my heel. What we usually see with it is that it's worse in the morning, and it's worse after you stand up and walk after you've sat for a little while. And a little while varies with different people. Some people it's 10 minutes, some people it's an hour and 10 minutes, some people it's 3 hours. It depends on the person and the severity of the case. But if it's worse in the morning, or after you've sat for a while and it gets better as you move around, and those first couple steps are awful, and then I move around a little bit and it gets better, that's when you're typically looking at plantar fasciitis. It's really important to know what you're dealing with when you're trying to treat something, because you don't want to go down what you think is the right path and then you find out that it was misdiagnosed and you could have been doing something else a little bit differently to treat that specific diagnosis. So there are kind of three things that me from a distance can do to help with your plantar fasciitis. And I'm going to show you those three exercises. But if they don't help or you don't see any improvement, certainly reach out to me, get in touch with me. The best thing you can do is see a physical therapist or another healthcare provider who's going to help you get to the cause of the problem. Don't go see somebody who's going to give you $300 orthotics and send you out the door and never check on you again, because they're not going to get to the root of your problem, right? What happens if you got to change your shoes? What happens if you got to go to a dinner, right, and you can't wear the sneakers that your orthotics fit in or the shoes that your orthotics fit in? What are you going to do then? So make sure you get to the root of the problem. If you don't know anybody or know somebody who you could trust, reach out to me. I have a ton of friends across the country, physical therapists who are really good at caring for their people and getting them back to where they need to be and getting to the cause of the problem. They're not going to leave you alone until they get to the cause of the problem, and I really won't either. So here are my 3 plantar fasciitis tips. If you guys find them helpful, share this out. If you know anyone who might benefit from it, please feel free to send it to them, and if you have further questions on it, reach out to me. I'm happy to go over that stuff. Enjoy, guys. Thanks. So if you're dealing with plantar fasciitis pain, the first thing you want to do is get a ball of some kind. This is a field hockey ball. You can use a lacrosse ball, any really hard ball. A tennis ball will do. A golf ball is a little bit small, but it'll get the job done if you don't have anything that's harder. Ideally, a field hockey ball or a lacrosse ball, something that's pretty hard and not going to squish underneath your foot. And all you're going to do is put it right underneath your foot. This is the first thing you should do in the morning. So before you even take that step to get out of bed, keep this guy next to your bed, put it on your nightstand, put it on the floor, whatever you have to do. Before you take your first step, just take it, right? If it was my right foot that was bothering me, all I'm gonna do is put some pressure and start rolling that out. Okay, what we're doing in this action is kind of artificially moving the tissue around, right? Naturally we do it when we move, when we walk on our foot. This is kind of tricking your body into saying, hey, we've already taken some steps. The first one we're going to take isn't going to hurt that bad, okay? By getting the tissue moving around in there. Now, I'm not pushing all my weight through this. If I was, that'd be pretty painful, and I don't even have it right now. I've dealt with plantar fasciitis in the past, but right now I don't have it. You want to push about 50% of your comfort zone, right? So it should be a little bit uncomfortable, but not unbearable. And you'll see I'm going the length of my foot, right? So all the way from my heel, all the way up to about the ball of my foot and underneath my toes, okay? This is a really effective way to start to loosen up some of the fibers and inflammation that happen when you lay down all night and then you go to get up and you take that first step, right? Your foot hasn't moved. So when you go to take that first step, it's really painful because the tissue in there hasn't moved. This moves it around for you in a way that will make the first step less painful. In addition to having a lacrosse ball or a field hockey ball close by, this is also really good to put under your desk at work. If you work in a desk all day and those first couple steps after you get up to walk around are painful, keep one of these close by. Keep it in your purse. I had a patient once who kept it in her purse, and then like when she was at a restaurant, she would just take it out, no one would know, and she would on occasion, she would just rub her foot against it. And that helped alleviate her symptoms and let her continue to walk around the city that she was in at the time. So keep this close by because it's a really, really handy tool. It doesn't take a lot of space, works really effectively. The other thing that you should be using is a water bottle, right? Take a water bottle, freeze it overnight, and the last thing you do before you go to bed is you should take the water bottle, stick it under your foot. Same idea, right? Not putting all your weight through it. You'll burst it probably that way. Don't put all your weight through it, but just a nice, easy, about 50% pressure, right, of if this is nothing and that's pushing as hard as I can, about 50% of it, and you're just gonna roll it along the length of your foot. It should feel really good, especially at night. The idea here is we reduce the amount of inflammation that you're gonna have when you go to sleep, right? You're gonna go to sleep, your foot's not gonna be moving a lot, so we wanna reduce the inflammation and try to break up that cycle, okay? So a minute or two of just rolling it, last thing before you go to bed, first thing right after you wake up. The last exercise I want to show you guys is a stretch for your calf, which is often a really tight area in people who have plantar fasciitis. So very simply, find a wall. I'll stretch my left calf so you guys can see. You're gonna find a wall, you're gonna lunge into it a little bit, keep your back leg straight, and you try to keep your heel on the ground. You should get a really good stretch all through back here, a little bit, maybe you'll feel it in your hamstring, but really you want to get it so you're stretching through here. A nice lean into the wall, you should get a really good stretch through that back of your leg there, back of your calf. 15, 30 second hold as many times throughout the day as you can. I really can't emphasize that enough, right? When you get up to walk around, you get up to stretch a little bit at work, whatever you're doing, find a wall, lean into it. It's really, really good, really effective, and the reason we need to do that is because your calf muscle goes in and it attaches into your Achilles tendon. Your Achilles tendon goes down and attaches below your heel. Your heel then attaches to the rest of that plantar fascia that goes along the bottom of your foot. So, really important to loosen up the tight calves with that stretch. Thanks, guys.